It is estimated that people with mental illness die 10 to 20 years early. This, coupled with a funding gap around mental health awareness in the country, is leading to even more burdens in accessing healthcare.
Mental disorders have remained among the top 10 causes of disease burden worldwide, with no evidence of global reduction since 1990. In Kenya, evidence shows a staggering 42% of individuals seeking care in primary health care facilities have symptoms of severe depression, with an estimated national prevalence of common mental disorders such as depression and anxiety at about 10.3%.
And as the globe celebrates the World Suicide Prevention Day, the Ministry of Health has launched the National Clinical Guidelines and an e-learning platform to close the treatment gap, currently at 75% to healthcare providers, aimed at improving literacy among workers and access to mental health care services at the first point of care.
There are several counties in the country without a single mental health worker. The gap of health workforce is going to be addressed by capacity building of the current health workers that we have, especially at the front line, the primary health workers, to have knowledge. It may not be so much, but enough knowledge to recognize a mental health disorder. To be able to know that this patient needs a referral to a competent person for diagnosis and treatment. This is really important for us, and it has a multiplier effect because we will be able to diagnose our patients early and access them care early.
With a petition presented before Parliament to decriminalise suicide by repealing Section 226, arguing that the legal framework is incompatible with constitutional rights to health and dignity, a need for continued home care has been touted as a pivotal to reducing stigma associated with mental health.
We get a patient, we treat a patient so well, and literally recovers from the perspective of the public. When he goes back home in the counties, he relapses because there is one important ingredient we miss: continuity of care. So with this training, we are going to have improved continuity of care, which is going to come out of implementing these guidelines. With improved access, we are going to have a significant impact in reducing the stigma that is bedeviling the mental health disorders.
Mental health is and remains listed as the top 10 disease burden worldwide. In Kenya, at least 42% of individuals seek treatment. Bentura Kwamboka, K24, Nairobi.